We're in the midst of a global pandemic caused by a novel coronavirus identified in late 2019. This novel coronavirus is SARS-CoV-2. It causes the disease COVID-19. COVID-19 was classified a pandemic on March 11th, and by mid-June, it killed nearly 500,000 people. Where did this deadly virus come from? We caught it from another species, bats, through a process called spillover. Spillover happens when pathogens like coronaviruses cross or spill over the species barrier. The novel coronavirus had a genetic mutation which changed the structure of the coronavirus's iconic spikes, or technically glycoproteins. The spikes work by fitting into cellular receptors like a key fitting into a lock. This opens a pathway for the virus to invade a cell. The spike's shape is determined by the virus's genetic code. When a mutation affects the glycoproteins, it can change its shape, making it become a new molecular key for another receptor. This allows the virus to infect new cells, making spillover possible. This is how a spike that originally fit bat receptors came to fit human receptors. When the new virus first entered a human cell, it replicated, infecting exponentially more cells in the person. Spillover occurred and the virus infected exponentially more people. This was what caused the novel SARS-CoV-2 coronavirus to emerge and start the pandemic. How it became plagued, literally, with COVID-19. Every new pathogen spills over through this process. Frequently, the virus starts in a bat, a reservoir for pathogens like the SARS, MERS, and COVID-19 coronaviruses, and the Ebola, Marburg, Nipah, Hendra, and rabies viruses. Bats aren't trying to infect us though, they just have superpowered immune systems which can provide crucial insight to how we can cure infectious disease of our own species. The problem is when we force bats and other species together, bringing them out of their habitat and into ours. By not logging in wild areas and not having wet markets, we can prevent spillovers. Understanding the biology behind spillovers can also provide useful insight into the development of medicine. Remember the receptors SARS-CoV-2 uses to invade cells? Scientists are researching ways to keep the virus from opening up the receptors, creating medicines to treat COVID-19 and save lives. It's crucial we protect ourselves from infectious disease. Thankfully, we have a real-life superpower, science. We can eradicate COVID-19 like we eradicated smallpox. We can even prevent more pathogens like coronaviruses from spilling over. We have the science. We just need to use it.